there were changes, I will likely have to get another biopsy. Hey guys, what is up? For those of you who don't know me, my name is McKenna, and I generally tell the stories of those who can't tell it themselves. So on this channel, we really usually cover crime cases, missing persons cases, murder cases, but today's video is going to be a little bit different. Something I haven't talked about with many people, generally just my family and a few really close coworkers, is my journey with finding a lump in my breast. I'm on my way right now for my follow-up mammogram. Back in November of 2019, I found a lump in my right breast, and I've always had very dense breast tissue, so that was no surprise to me. It was just the actual feeling of the lump was just different. It was harder, it just felt different. So initially I went to my primary care provider. He did a breast exam and he said, you don't need to worry about this, McKenna. This doesn't feel anything like breast cancer. The masses are movable, they're symmetric, they just don't feel like what I would expect breast cancer to feel like. So I went home, and then a week later I just still felt like something was wrong. And I just want to say really quick, I have the most amazing primary care provider. I've had the same family doctor since I was born. I never had a pediatrician. I've always had the same family doctor. He's amazing. He can never retire, and I love him so much, and he's so supportive. So I just didn't feel right. So I called his office, and he put in for an ultrasound of my breast. So I went to our breast clinic, our breast center, affiliated with my primary care provider, and they ultrasounded that right breast. There was a whole team, because I go to an academic center basically, and they were like, your breast is so dense that even if we thought we saw something, we would never even know because your breast is so dense. So let's go ahead and do a bilateral mammogram. So when they did the mammogram, I knew something was wrong because they came back 10 minutes later and said we need to do more scans and do different angles of the breast. So initially I was really nervous, obviously. From there, she came back in, took me back into the ultrasound room, and she ultrasounded both breasts, and the physician at that time said, we think we see something in the left breast. It just looks odd. It looks like what they call puckering, which is, please don't laugh, which is a concern for a mass in the breast tissue that would be pooling and puckering other tissue. So she said, the only way we can know what that is to biopsy it. So obviously I was terrified, and at that point they made me a BI-RAD 4, I think. If you're familiar at all with breast health or with breast cancer or concern for breast cancer, they give you a level, and it runs anywhere between 1 and 6. So a BI-RAD 4 was pretty high. It means there's not heavy suspicion, but definitely suspicion for breast cancer. So I got the biopsy done, which, if you want to know more about what it's like to have a core needle biopsy of your breast, I can go into that. Maybe I'll do that later in this video, but right now I just want to give you the rundown. So I had the biopsy done. They took 12 samples while they were in there, and I got those results, I think, in 48 hours. Those were negative. It was amazing. It was the best news you could possibly get. But they still were not satisfied with the fact that my breasts were so dense and the tissues were so dense. There was concern that a mammogram wouldn't pick up a cancerous mass in my breasts. So from there, the physician put in an order for what's called a problem-solving MRI, and that basically means we don't know what's wrong with this chick. Her breasts are super dense, and we want to make sure that she doesn't have breast cancer. Now, it's also kind of weird with health insurance. You have to have a certain level of risk, especially at my age. I'm only 28 years old. You have to have a certain level of risk to qualify for your health insurance to pay for the breast MRI. luckily I have really good health insurance. I'm not at all bragging about that. I feel extremely lucky that I have very good health insurance. But basically it took about 2 weeks to get approved, and then finally I went for my breast MRI, which again, I can go more into that if you want to know what a breast MRI is like, where you get the IV and they give you contrast and blah blah blah. And then I got a phone call that looked good and that looked normal, and that's again amazing news. The only thing that was noted was there was significant chip migration, which basically what happens is when they give you the breast MRI, or I'm sorry, when you get the breast biopsy done, they put a little titanium chip in your breast exactly where they do the biopsy. And that way, moving forward, if at any time you ever have a breast like mammogram or ultrasound or literally any other test done, imaging done of your breasts, the physician at that time will then know, hey, at one point this was an area of concern. So that's why they put the clip in. The clip had significantly migrated, which isn't a problem. When I talked to the physician, basically she said that happens a lot and that it's not problematic at all. So now I'm on my way for my follow-up mammogram, where they're going to do another mammogram and they're going to compare the original mammogram to this mammogram to see if there were changes. If there were changes, which I'm praying and hoping and knowing that it's going to be fine. If there were changes, I will likely have to get another biopsy. If there were not changes, I can wait many years and go back for another breast MRI, they suggest at 40 years old. So I will keep you posted. I'm almost at the breast center. My appointment is at 8:30 a.m. and it's 8 o'clock right now, so I'm making good time. And then I have at 9:30 an appointment with the breast surgeon who I met with initially after my biopsy, before the breast MRI, and I'll keep you posted. Okay, love you guys. Bye! Hello. So basically what's happening now, if you can hear me, is that my mammogram came back okay, but the breast surgeon, when she did an exam, found other areas of concern. So now I'm going to get bilateral ultrasounds again. So I will keep you posted. Didn't even lock the door. That was good, McKenna. Now you might be wondering what we're doing, and we're buying a bag of dog food for the homeless guy down the street who's panhandling with his dog. Listen, nobody can help everybody, but everybody can help somebody. Okay, I'm back home. I've had a couple minutes to gather my thoughts. I can fill you in on what happened. So basically, I went in for a left mammogram so that the physicians could compare the new mammogram to the one I received post biopsy. And the reason for that is so that they can look and see if there have been any changes. The good news is there were no changes, which is spectacular news. That means there's no cancer growing there, there's no new mass, whether it be benign or cancerous. That's perfect news. When I had my clinical exam, which means the physician comes in and palpates the breasts, feels if anything has changed, she marked up a couple different spots. I don't know if you can see them on here, but she took a pen to a bunch of different spots. Those were areas of concern. Also, if you hear the cat, I'm sorry, but I can't film with her in here because she just won't stop pestering me. Anyways, those were areas of concern for the physician. She's a breast surgeon, and she said they just don't feel right. I'm just not comfortable sending you home without looking at them. So I went over, I had those ultrasounded, and that's where you saw me waiting forever and a day to get that done. I'm not upset. I have a fabulous team, and they really care about the person, the individual. They don't really brush things under the rug. They want to know if you've seen any changes, and they want to get you tested right away. So then I had the ultrasound done. That was bilateral, meaning they ultrasounded both breasts, and those looked okay. Basically what they told me was that I have extremely, extremely, extremely dense breasts, which we knew this already. In fact, some physicians have now told me that they are some of the densest chichas they've ever worked on. So moving forward, their recommendation is that I go back once a year for a bilateral mammogram and for a clinical breast exam. That seems extreme for somebody who's 28, but the reason I want to make this video and kind of talk to all of you women out there is that you have to be your own advocate. If you feel something, then you need to say something. Not to mention, you need to be checking yourself in the shower every month and making sure that you really know what your breasts feel like, because you're going to be the one to notice if something is different. You also need to find yourself a team that cares about you and is proactive, not a team that is going to brush things under the rug or wait to see what happens. I love my primary care provider, and while they're fabulous for numerous reasons, and I would never ever want a different doc, they don't specialize necessarily in breast disease and disease process. So if you feel like something is wrong, or you just have this inkling like, you know what, this just doesn't feel right, these feel different, then you really need to push to be seen by a breast surgeon or somebody who specializes in that area. I also think it's really important to talk about the fact that it's not always breast cancer. You can have areas of concern that are not breast cancer. For me, it's fibrous tissue. It's just really thick, dense breast tissue that can be really painful. I have a lot of breast pain, and actually it's mostly connected to my period. So when my hormones are changing or fluctuating, that's when I notice that I have such terrible breast pain. My physician did recommend taking vitamin D, which I now take every day, and that has seemed to help with the frequency of breast pain. I think I take about 2,000 IUs a day, I think. Check with your physician. There's no scientific reason or a research-based reason for vitamin D to help with breast pain. However, anecdotally speaking, women who tend to be low in vitamin D tend to complain more about breast pain. So that is why my breast surgeon told me that I should start taking vitamin D, and I can say from personal experience that it has helped. So with all of that being said, I just want to encourage you to be your own advocate. This has been my journey. This has been my very strange bout with breast pain and breast tissue and blah blah blah. But I guess the end-all story or the moral of this video is that you need to be your own advocate. And if you feel like something's wrong, then you need to say something. If you feel like you need to be seen, go get seen. My physician at the very end of our appointment today, after my 4.5 hours of being there, was really wanted me to know that even though my tests were negative today and everything looked great, which was really great news, if something changes or if I feel like I need to be seen again, she said, call me. Don't hesitate. Call me. Schedule an appointment. I will check. We will do diagnostic tests. You're the one who knows your breasts, and you're the one who knows if something changes before we ever will. So she wanted to make it clear that even though the tests were negative, something can always develop, something can always happen, so please call us. And I want you to know that. Even if you've tested negative in the past for whatever it be, if you feel like something has changed, then you need to reach out to your physician. I want to thank all of you for listening to me today. I'm not sure kind of why I put this together. It just felt like necessary to talk about my experience, maybe share with you so you know you're not alone. I also want to send a huge shout out to my friends who I know are struggling with breast cancer right now. I can't imagine what you're going through. It sucks being the patient. As somebody who works with patients, it sucks being the one who's being taken care of and being the one who is going for all these tests. So my heart goes out to you. I'm praying for all of you. I love all of you. I want to thank you for listening to my story and hearing me. Please let me know if you have any questions down in the comments below. I, of course, if you're interested, I will make a video about what it is like to have a breast biopsy. I can make a video what it's like for all these diagnostic tests and kind of what those entail, but I won't do it unless you're interested in hearing about it. So let me know. I love you all. Thank you so much for joining me, and I will see you in the next video. Bye, guys.